Hello, everyone. I'm Doug Elmendorf, Dean of Harvard Kennedy School, and I'm delighted to welcome you to this year's Robert McNamara Lecture on War and Peace. We're fortunate to be joined today by Craig McNamara and Mark Pastor, children of Robert McNamara, and we are grateful for the support of the McNamara family for this important lecture series. I want to begin by offering my heartfelt sympathy to everyone joining us who is from Ukraine or who has family or friends in Ukraine. As I wrote to the Kennedy School community yesterday, I cannot imagine the fear, sadness, and anger that you are feeling now. The pictures and stories of the Russian invasion of your country are horrifying to me, and I know to people around the world. For both individual people and families and for the world as a whole, this war is a terrible tragedy. I will keep the people of Ukraine in the forefront of my thoughts in the days ahead. Today, we have an extraordinary opportunity to learn more about a different fundamental challenge in our world, which is COVID-19, and to learn about the global response to it, and very importantly, how we can build stronger health infrastructure and achieve greater health equity over time. Our distinguished guest speaker is Dr. Tedros Ghebreyesus, the Director General of the World Health Organization. Before joining the WHO, Dr. Tedros built a career in health and public policy in Ethiopia and globally. Dr. Tedros has a PhD in community health and worked to improve the delivery of health services, first as a field-level malariologist, and then as the head of a regional health service, and later as Ethiopia's Minister of Health and Minister of Foreign Affairs. As Minister of Health, he led a comprehensive reform of his country's healthcare system that committed to universal health coverage and the provision of services to all people, even in the most remote areas. Then, as Minister of Foreign Affairs, Dr. Tedros elevated health as a political issue in the world. He's held many leadership positions in global health, including chair of the Global Fund to fight AIDS, tuberculosis, and malaria, chair of the Rollback Malaria Partnership, and co-chair of the Partnership for Maternal, Newborn, and Child Health. Dr. Tedros will be in conversation today with my friend, Dean Michelle Williams of the Harvard T.H. Chan School of Public Health. Dean Williams holds the Angelopoulos Professorship in Public Health and International Development, which is a joint faculty appointment of the Harvard Chan School and the Harvard Kennedy School. We need to find ways to persuade Michelle to spend more time at the Kennedy School with us. But we are lucky to have her here today. Dean Williams is not only an important academic leader and award-winning educator, she is also a nationally recognized epidemiologist and public health scientist. She focuses in her own work on reproductive, perinatal, pediatric, and molecular epidemiology. She has led large-scale clinical trials and published hundreds of research papers. We are very fortunate to have the chance to learn today from our distinguished guests, Dr. Tedros Ghebreyesus and Dean Michelle Williams. Please join me in giving them a warm welcome. Thank you.
Thank you so much. Thank you so much, Dean Elmendorf, my good friend. And welcome, Dr. Tedros. I understand that you have some prepared remarks to share with us. But before that, I just want to also express my welcome and share with you our deepest condolences from the entire Harvard community on behalf of the unconscionable loss of 8 individuals working to vaccinate children in Afghanistan against polio. We all stand with you in condemning the violence against public health workers. And thank you again. Over to you, Dr. Tedros.
Thank you. Thank you so much, Dean Williams. Thank you, my sister, and also to Dean Douglas Elmendorf, and to McNamara family, students of the Harvard Kennedy School and the School of Public Health, dear colleagues and friends. Good afternoon, and thank you so much for the privilege of delivering this year's Robert McNamara Lecture. This is indeed a great honor and such a great pleasure. But I must admit that the task of delivering a lecture with war and peace in its title weighs heavily on me at a time when we're now seeing conflict in Europe of a kind we all hoped had been consigned to history. Like you, we're watching events unfold in Ukraine with deep concern for what this will mean for the region, the world, and especially for the health of the affected populations. And sadly, Ukraine is not the only conflict in our world. From Afghanistan to Myanmar, Yemen, and my own country of Ethiopia, it's an unfortunate reality that all too often conflict and disease go together. The authors of WHO's Constitution were well aware of the link between health and peace, which is why they wrote in the preamble that the health of all people is fundamental to the attainment of peace and security, and is dependent upon the fullest cooperation of individuals and states. Since those words were written, the world has faced many outbreaks and epidemics. Just this century, we have seen H5N1 influenza, SARS, MERS, the H1N1 pandemic, multiple Ebola outbreaks, Zika, and more. But of course, nothing matches the scale of the COVID-19 pandemic, which has thrown the world into turmoil for more than 2 years. COVID-19 is a powerful demonstration that a pandemic is so much more than a health crisis. It illustrates the interconnectedness between health and the economy, security, education, and the intimate links between the health of humans, animals, and our planet. There are many lessons to learn about what has worked and what has not. Let me suggest 5. The first is that science must guide policy, not the other way around. Throughout the pandemic, WHO has convened thousands of scientists from around the world to examine the rapidly emerging evidence and distill it into the guidance we give the world. Just this week, we have convened a research and innovation forum to identify the most pressing research priorities and chart the way forward. Science has given us valuable insights into how this virus spreads, how it causes disease, and how to stop it. But in some countries and communities and on social media, the marginalization and politicization of science has impeded the response to the pandemic and cost lives. Politics undermining science. My point is not that science should be the only consideration in decision-making about public health. My point is that science should be the central and guiding consideration. The second lesson is that science can in fact widen inequalities unless it's paired with a commitment to equity. I'm sure that most or all of you are vaccinated. And yet, as we speak, 83% of the population of Africa is yet to receive a single dose of vaccine. Vaccine nationalism, export bans, and bilateral deals between manufacturers and high-income nations severely restricted the number of doses COVAX was able to ship in the first half of last year. The supply situation has now improved, and COVAX has now been able to ship more than 1.2 billion doses of vaccine to 144 countries and territories. WHO and our partners are now working night and day to support countries to turn vaccines into vaccinations, to reach our target of vaccinating 70% of the population of every country by the middle of this year. To reach that target, we're calling on all countries to urgently fill the Act Accelerator's financing gap of $16 billion to ensure equitable access to vaccines, tests, and treatments and PPE everywhere. The third lesson is that a resilient health system is not the same thing as an advanced medical care system. Even some countries with the most sophisticated medical care were overwhelmed by COVID-19. By contrast, some middle-income countries with fewer resources fared much better, thanks to investments in public health after outbreaks of SARS, MERS, H1N1, and others, especially in the Mekong region. For instance, the simple art of contact tracing is one that many high-income countries have struggled with, but it's one that many low and middle-income countries have done well because of their experience with infectious disease outbreaks and their investments in public health. The backbone of public health is robust primary health care for detecting outbreaks at the earliest possible stage, as well as for preventing disease and promoting health at the community level. The fourth lesson is that the world needs a new agreement that sets the rules of the game for responding to epidemics and pandemics. Instead of a coherent and cohesive global response, the pandemic has been marked by a chaotic patchwork of responses, which in some cases have punished countries for doing the right thing, as in the case of the travel bans imposed on South Africa and Botswana when they first reported the emergence of the Omicron variant. And the fifth lesson is that trust is everything. A study published in The Lancet earlier this month examined the reasons why some countries have had higher rates of infection and death than others from COVID-19. The age profile of the country, GDP per capita, and mean body mass index were all found to play a part. But the researchers found that perhaps the single most important factor in countries' preparedness and ability to respond effectively is trust. The study concluded that stronger risk communication and community engagement are essential for making the world safer against future epidemics and pandemics. Vaccines, diagnostics, therapeutics, and other tools are essential, but the most effective tool is engaged and empowered communities. Science, equity, public health, cooperation, and trust. So what's being done to apply these lessons? In fact, quite a lot. There is a strong consensus that the world needs an enhanced global architecture for pandemic prevention, preparedness, and response. The recommendations of the various panels fall into 4 areas or pillars. First, we need stronger governance. Instead of the confusion and incoherence that has fueled this pandemic, we need cooperation and collaboration in the face of common threats. At a special session of the World Health Assembly last year, WHO's 194 member states decided to negotiate a new international instrument to provide the rules of the game for pandemic prevention, preparedness, and response. Just as countries have united in the past to adopt treaties against tobacco, nuclear, chemical, and biological weapons, climate change, and more, so now the nations of the world have made a strong statement that health security is too important to be left to chance or goodwill or shifting geopolitical currents or vested interests. Over the past 2 days, the Intergovernmental Negotiating Body for this new instrument or treaty held its first meeting here at WHO headquarters in Geneva. A new international accord will not solve every problem on its own, but it will provide an essential overarching framework, the rules of the game, for a more coordinated and harmonized response to future epidemics and pandemics. Above all, obligations from countries. Second, we need stronger financing. It's obvious that nationally and globally, we need substantial resources for strengthening global health security. Our analysis estimates the needs at $31 billion per year. to close the gap for the most essential functions, such as surveillance, research, and market shaping for countermeasures, we support the idea of a new dedicated financing facility, anchored in and directed by WHO's constitutional mandate, inclusive governance, and technical expertise. Third, we need stronger systems and tools to prevent, detect, and respond rapidly to epidemics and pandemics. Already, WHO has taken steps to build some of these systems and tools. To strengthen surveillance, we have established the WHO Hub for Pandemic and Epidemic Intelligence in Berlin to harness the power of collaborative and artificial intelligence and other cutting-edge technologies. To facilitate greater sharing of pathogens and clinical samples, we're piloting the WHO BioHub system based at a source facility in Switzerland. To improve mutual accountability, solidarity, and cooperation between countries, we are piloting the Universal Health and Preparedness Review, a new peer review mechanism for enhancing national preparedness based on the gaps identified to improve and strengthen national capacity. And to strengthen capacities for local production of vaccines and other health products in low and middle income countries, we have established the WHO Technology Transfer Hub in South Africa, which has already developed its own mRNA COVID-19 vaccine candidate. The choice for South Africa is because the greatest gap is in Africa. Of course, the South Africa mRNA Hub will serve Africa and the rest of the world. And fourth, we need to understand how this pandemic started. We owe it to those who have died and their families to do our best to identify where this coronavirus came from. It's important to understand that WHO does not have a mandate to investigate outbreaks on its own. Our role is to conduct joint studies with affected countries at their invitation. Especially with the negotiation of the member states, I hope this will improve and WHO will have a mandate to investigate. That's what we did in China last year, joint studies. Every hypothesis remains on the table, and we're continuing to make progress. But we have also experienced setbacks in sharing of data, especially lab records. Just last month, I met with Premier Li in Beijing during my visit to China for the opening of the Winter Olympic Games. We discussed the need to advance studies into the origins of the virus, including those relating to a potential lab accident. To establish a more systematic way of identifying the origins of future outbreaks, we have established the Scientific Advisory Group for the Origins of Novel Pathogens, or SEGO. There is much more that could be said about each of these areas, and I look forward to our discussion over the next 45 minutes. Above all, the COVID-19 pandemic reminds us that health is not simply a luxury for the rich. It's a fundamental human right. But it's also a right that not everyone enjoys equally. Last week, the world lost one of its foremost public health professionals, my good friend, Paul Farmer. Paul was one of Harvard's most distinguished alumni, holding an MD and a PhD, and was the Coloctrons University professor and chair of the Department of Global Health and Social Medicine at Harvard Medical School. Paul passed in his sleep in Rwanda, where he was doing what he loved to do, supporting medical education at a district hospital. He was a great humanitarian and a tireless champion of equity and health as a human right. Paul once asked, if access to healthcare is considered a human right, who is considered human enough to have that right? It's that right that I and the thousands of people I'm honored to call my colleagues work for every day. Not health for some, not health for most, health for all. Michelle, thank you, and back to you.
Thank you so much, Dr. Tedros, and thank you for remembering and reflecting on the tremendous contributions of our dear friend, Paul Farmer, who in the short 62 years of his life accomplished so much in the name of equity, social justice, and health for all. Thank you for remembering our dear friend. And also thank you for these incredibly thoughtful remarks and reflections on lessons learned. And I'm privileged to begin this conversation by asking to go a little bit deeper on one that we are all grappling with today. And that is, we're recognizing that while more than 10 billion doses of COVID-19 vaccine have been administered globally, only about 10 to 12% of people in low-income countries have received at least one dose. Now, you've shared with us very important lessons learned, but I anticipate that there are continued barriers to expanding global vaccinations, and wondered if you could share with us additional thoughts about how we can rally the world around this vital mission of equitable vaccination, as it's in all of our interest that we vanquish the spread of this threat to us all.
Thank you. Thank you so much. That's a very important question. As you know, in April 2020, we have established Act Accelerator. And the purpose of Act Accelerator was, it has three pillars, by the way, for vaccines, diagnostics, and treatments. And the two objectives were, one, to accelerate the development of new tools, the three tools which I have outlined. And the second objective was equitable distribution. Of course, as you know, we have succeeded in accelerating the development of vaccines, diagnostics, and treatments, historic, actually, proportions. However, we failed on equitable distribution. And that's why, especially in Africa, 83% of the population didn't get even, a single vaccine dose. So to rally, as your question, to come back to your question, to rally the world, one thing that's very important is this is a shared threat. Unless we support the whole world, unless we vaccinate the whole world, we will all be at risk. It's like what we have been saying, no one is safe until everyone is safe. So we have to understand that this is in the best interest of everyone, every person, every nation. And that's why vaccinating the world is in the interest of the world, and we should do it. And one thing we have been pushing was donating vaccines. There is improvement now. We're getting more vaccines. But at the same time, we need also to finance Act Accelerator so that we can procure enough vaccines to achieve the goals of 70% by mid this year, 70%, of course, in each country. As I said in my speech, there is a gap of $16 billion. Considering the impact of this pandemic on the economy and the amount that many countries are spending to fight the pandemic, $16 billion is really insignificant. So we have asked the global community and donors to give their fair share of the $16 billion. If that happens, then we can achieve the 70%. But while addressing the pandemic now through donations of vaccines and through financing COVAX and Act Accelerator and financing the operations so people are vaccinated, we're also focused now on the strategic solution because there is a systemic change. One of the problems or the root causes of the inequity is the lack of production, especially in low and middle income countries, production of vaccines. production of vaccines is monopolized by high-income countries or upper middle-income countries. As a strategic solution, we're investing in local production, and that's why we have opened up the mRNA or established the mRNA technology transfer hub in South Africa. And we have identified hubs in Africa and all over the world. So there is capacity in those countries, and there is local production in those countries. And then in the future, the equity problem could be addressed. So that's what we're trying to do. And the mRNA technology, as you know, not only for COVID-19, we believe that it could help with HIV, malaria, TB, which is by and large affecting the low and middle income countries, and including cancer. So we're trying to do everything to fight the pandemic now, and at the same time addressing the systemic issue by really having strategic solutions like local production. And your support advocating for this will be very important. And as academic institutions, you can also participate in building capacity. Some of the institutions participating in South Africa are like Stellenbosch University, academic institutions that are helping with developing the formula for the mRNA vaccine. So I believe academic institutions have also a role to play in advocating, but at the same time, building capacity. And thank you, and back to you.
Thank you for that very inspirational and strategic and tactical response. And I will say, one of the things we've all learned is the importance of public, private, and academic partnerships. And if we do it right, it can truly be transformative. Your response anticipated a number of questions that I had, but I want to continue on this thread of capacity building with a specific emphasis on how do we seed global innovation. It's really vital that we support capacity building, but that we also cultivate and enable the basic science and the innovations that are needed to solve the biggest threats to global health, that we allow for that innovation and that research and development to come from the global South. And I'd like to basically ask you, where do you think we have fallen short in enabling R&D and innovation to come from the global South? And what can we do to improve the cultivation and enabling of discoveries from across the globe?
Yeah, thank you. Thank you so much. That's a very important question. When I was foreign minister, I was involved in the development of a strategic plan for Africa. That's a 50 years plan. We were preparing it actually in 2013. So from 2013 up to 2063. So this is a 50-year plan. And we were doing some assessments of what we have in the continent. And one of the challenges we have identified, which may actually affect on how we can do in the South, especially in research and development innovation, is most of the students are actually go to social science. Minority go to science, technology, and engineering. If that continues, I hope the situation is improving now, the problem will be from the root. So it has to be corrected from the root. And one of the recommendations we had, as you know, during that development of the Africa we want, the 2063 plan or the 50 years plan was to change that. Of course, we need social scientists. We need them. But the significant proportion, if you like, 70-30, should be in engineering, in science and technology, which was not the case. And academic institutions, most of Africa focused on social sciences, training management, training business, training anthropology, training that but not on engineering, on technology, and on science. That's dangerous. So I hope many countries have listened then, but of course, this is from 2013, 9 years ago. You may not expect a significant change. So, of course, I hope there is some improvement, but continued improvement, training, education in science, investment in science, technology, engineering will be important. Then, that being the responsibility of the countries to really shift into that kind of investment. And then there will be a need for South-South and also North-South cooperation to support those countries in research, development, and innovation. And it's doable. For instance, from all the countries in our continent, if there is one country that has a significant investment in science, engineering, and technology, South Africa. And I was there 2 weeks ago. I have visited Afrigen. They have already developed the mRNA formula. And they're ready now to test it in an animal model, and then followed by, the safety, and then all the steps, phase 1, phase 2, phase 3. And they estimate that by 2024, they can have something approved. They're very confident and upbeat. So partnership with those institutions like Afrigen, BioVac will be very important. And I know Ghana, Senegal, Rwanda are making investments, and also Tunisia and Egypt, especially from Africa and Nigeria. So I think partnering with those countries, and especially academic institutions, South-South and North-South, will be very, very important. When I was Minister of Health, I have tried it. But I think these are the two things we should do. One is inside, investment in science, technology, engineering, and most of the students we provide from undergrad should really graduate in those. Second is partnership with the outside world to really strengthen the research and development and innovation of countries. But there is a huge potential, to be honest, from what I have seen in many countries in our continent.
Yeah. The talent is widely distributed, but the opportunities are not necessarily equally distributed. And your vision is motivating, because I do believe that many of the challenges we're facing globally, some of the solutions will come from the global South. And it's not always going to be a one direction of knowledge and innovation flow.
Exactly.
Thank you for that.
And that's why, by the way, we say talent is universal, opportunity is not.
That's right.
So we need to create the opportunity. Thank you. Exactly what you said.
I have time for one more question, and I wanted to be a bit more wistful, which we have not allowed ourselves to do for the last 24 months as we struggle through this pandemic. But before the pandemic, as the Director General of the WHO, you set forward an audacious and ambitious, far-reaching plan for high-impact transformation of the WHO. I personally was impacted by the bold vision you had for universal health coverage and strengthening the health security agenda. What I'd like to do is to ask, where do you believe you and your agenda would be today had it not been for the pandemic? And what would the world look like?
Yeah, thank you. Thank you so much. I fully agree with you that the pandemic has disrupted some of the things we have started. But on the other hand, it has also enhanced some of the things we have started. So it has actually both impacts. If I tell you on what the pandemic itself has enhanced, is on research and development, which you said. As part of the transformation, we have appointed a chief scientist, we have established a science division, and we strengthened the research and development blueprint of the organization, which started actually before I joined. And when the pandemic started, we had to use that science division and the chief scientist, which helped us to do the solidarity trials on treatment, the solidarity trials on vaccines now, and also all the guidance, the norms, standards we have been issuing, several of them. And that part, the science part, the core business of the organization has actually succeeded because of the pandemic, and there was some acceleration because of the pandemic. And then the other was the division of pandemic preparedness, which was part of the transformation. We were enhancing emergency preparedness and response, and that also helped us to fight the COVID-19 pandemic. By the way, before that, it also helped us fight the Ebola outbreak in DRC. We have this target to contain it in DRC and make sure that it's not out of control like the 2014 Ebola in West Africa. And we succeeded because of the changes we have made actually in the emergency response. So there are areas that have really were impacted in a positive way by the pandemic. And there are areas that were not. One is, as you said, the universal health coverage. One of the targets we had was to convince countries to include health as a fundamental human right in their constitution. So health for all is constitutional in countries. And because of this distraction, we have convinced some, but we haven't convinced many. And many countries still commercialize health, which is not good. So we have to invest more on that. And the other was, as part of the health for all, investment in primary health care. That was also impacted. And there are others. But we will try to continue now, since the pandemic is surely, but slowly or surely, getting under control. We will resume the transformation in a big way, because the pandemic has reminded us that health is central, and all the priorities and transformation ideas we have set for ourselves are actually important and have to be implemented. And I'm very lucky that the board has already endorsed me unanimously for the second term, and look forward to working with you very closely. As you know, Michelle, I have strong connection with Harvard. I started in 2004 with partnership with Brigham Women's Hospital, with Mark Davis. And then, of course, the award you gave me, the
Julius Richmond.
Yes, and I used to be involved also with the Harvard ministerial leadership with Michael Sinclair. And now, such a great honor to be introduced with McNamara family. By the way, I will definitely visit them in California. It's such an honor for me actually to be connected with them. Thank you for connecting me with them. And look forward to working with you. And we would like to have you and the School of Kennedy actually to be in Geneva to discuss about what we can do together in the transformation, the kind of support that you can give us. Because health, we shouldn't see it in its strict sense of health. It's really bigger and wider. It touches many things. It touches the economy, it touches the politics, it touches our social fabric, and touches almost everything. Everybody knows that now. So I would like actually to use this opportunity to invite you and also Dean Elmendorf to visit and discuss on our cooperation to really push the transformation agenda forward, because I believe since my links since 2004, I think maturing that relationship will be very important, and WHO needs your support. And back to you, Michelle.
Thank you so much. Thank you. I see my dear friend Doug on. Would you like to say something, Doug?
I just wanted to gratefully accept Dr. Tedros' invitation for us to work with you, Michelle, and with him and his colleagues at WHO to see what role we can play in helping to make a healthier and safer and better world for everyone.
Absolutely. You've heard it. We want to be a part of the force for good. And I also want to say, before we segue to having our students engage with you with some in this conversation, that we thank you for your leadership, for your vision, and for your steadfast commitment to global health. And we, again, want to be a part of the team and for Harvard to be a force of good with you and your colleagues. What I'd like to do now is to welcome the first question from our student from Harvard College, and his name is Lap Wen. Lap, I'd like to turn over to you.
Hi, thank you so much, Dr. Tedros. And thank you so much for all the hard work you and the World Health Organization have done to save lives during this pandemic. You mentioned that trust is the critical component of effective implementation of public health actions. However, politicians globally, as you've mentioned, have fueled the erosion of public trust in institutions to further their agendas and maintain powers. So do you believe that the World Health Organization has been effective or has failed to adapt its messaging to address the erosion of institutional trust? And if it's the latter, what should the messaging strategy of the World Health Organization be moving forward to build trust globally, even when politicians from its own constituent member states continue to undermine the organization?
Yeah, thank you. Thank you very much. As you know, whatever messages, thank you so much. That's a very important question, by the way. As you know, from the start, we have been communicating with the world. As soon as we declared the emergency, we had 5 pressers a week. It's almost every day, every weekday. And then, of course, after that, we moved into 4 days a week, 3 days a week. So we have sustained once a week. And from the feedback we got, I think it helped. And globally, from the information that we have, they want us to continue, meaning there are benefits. But it doesn't mean that that's really perfect and there will be problems. And we need to study and understand how the messages are received and how the messages are used, because there will be, challenges definitely, and we can learn from them and improve. But if there is one thing that we have understood, the regular communication is important, and many have benefit. But we have also to understand the weakness areas, and we have to learn from them and improve. As you know, on fighting misinformation and disinformation, we cannot do it alone, and that's why we have partnered, by the way, with the tech industry, and we have partnered with almost all of them, and they have been supporting us. But as you know, the social media benefits, it has benefits, but it has also it has also served as a vehicle for misinformation and disinformation. And not only the messages we send, as I said, on weekly basis, partnering with the tech industry and other partners will be very, very important, because it should not be just WHO alone that should communicate. It should be other stakeholders as well that should really communicate. But not only working with tech industries, we're working also with member states, because we know politics can be an enhancer of science, and using the political leadership to enhance science will be very important. But not only the formal political leaders, we have also to use other leaders. The academic institutions are leaders in their own right, and there are community leaders, and all leaders actually should be involved in communication, and it should be the effort of everybody. And WHO has a convening power, and one area which needs probably strengthening for the future is not only the voice of WHO directly, but to use as many partners as possible to use, to involve them in messaging, so people can get their message from whoever they trust. So there is a better communication, because we cannot force them to trust us, but at least we can work with someone who they can trust. And that's why I'm saying, in addition to messages we send, and people can trust, but we have to involve other stakeholders who can be trusted by their respective constituencies. So that's what we're thinking, but it's not easy, and this is a very important message. And trust is, I think, very, very difficult, and we have seen throughout that there is serious trust deficit. Thank you, Lap Nguyen.
Thank you so much.
Thank you, Lap. I'd now like to invite Hannah, who is also a student at Harvard College, to present her question to Dr. Tedros. Hannah, over to you.
Hello, Dr. Tedros. My name is Hannah Kiros. I'm a senior at Harvard, and my family's from Ottawa, Ethiopia, and we're I'm so proud of you, and I know all of Tigray is so proud of you. So this is just very special. I wanted to ask about how your experience as the Minister of Health in Ethiopia has informed your work at as the director of WHO and just your pandemic response in general, because during your tenure as Minister of Health, the progress made against malaria deaths and AIDS deaths were really, really dramatic and just a beacon of hope for all of Africa. So I was just wondering how those successes may have informed how you've approached your work now on the global stage.
Yeah, no, thank you. Yeah, thank you, Hannah. Thank you. Very nice to hear your voice and to also see you. Glad also to have a question from my fellow citizen. On the issue of my experience as Minister of Health, whether it has benefits or not, I think it does. Not only as a Minister of Health, also as a foreign minister. Minister of Health, of course, directly, but as a Minister of Foreign Affairs, I can understand from whatever I can do in WHO from a different perspective. I remember when I was Minister of Health and there was a cholera outbreak in Ethiopia. And this is in the central part of Ethiopia, actually. And when I remember my late boss, Mellis, said to me, okay, this thing seems serious, so you have to make it yourself. You have to go and check. Because finding first-hand information as a minister can really help you understand the situation and fight it better. And the reason I raised that is when the COVID-19 hit, the first thing that came was not really to remove the DG hat, like I did remove the ministerial hat and go to the ground to see for myself. So I went to China to understand for myself. By the way, I did the same thing when Ebola outbreak started. Go to Beni, go to Butembo and Katwa to see for myself, understanding what's really happening. That could help you to respond. So one thing I learned from as Minister of Health, maybe from Ethiopia, is the minister doesn't mean that it should not be, linked with what's happening on the ground, understand what's on the ground, and address it. It should not be like when you're a minister. Normally, you say, okay, you're a minister, and there is the protocol issue, but you're one of the persons who should handle this personally. So that's what I was told, and that's why I was on the ground 14 times, by the way, in Ebola. And then I was one of the first actually few to go to Beijing, even before even understanding to go to Beijing. So that's what I would understand as a minister, that we are one of the colleagues who have a division of labor and understand the situation, and we need to fight alongside our colleagues to address the problem. But in addition to that, I raised the foreign ministry portfolio. I actually proposed the idea of having an Africa CDC in 2013.
Yes.
And this was in Abuja. And my foreign minister colleagues told me that, please remove your Minister of Health, cap, because you're the foreign minister. Why are you suggesting the CDC or whatever in foreign minister's platform? But health is cross-border, and it can involve foreign ministers, it involves politicians, it involves others. So from my foreign ministry, one thing I saw is the importance of the role as foreign minister, because it can address the cross-border issues. So as Minister of Health, hands-on, as foreign minister, the cross-border. And I think I'm using both in WHO, because they both experiences actually helped me to see the not only the health angle but the other angles. So thank you, Hannah, and all the best.
Yeah, thank you so much for your work and for your answer.
Thank you, Hannah. You brought back wonderful memories of my brief time in Ottawa. Thank you for that question. And what I'd like to do is also recognize the brilliance of advocating for the creation of the Africa CDC. And I'd just like to express my thanks to you, Dr. Tedros, for leading the way for that, and to recognize our dear friend, John Nkangasong, who has done a fabulous job making the concept begin to be a reality just at the right time when the continent needed to be coordinated in a Pan-African way. So thank you for that. I would like to invite one of our Harvard Chan School students, Farah Shroff, to bring forward her question.
Thank
Over
you
to you,
so much. Thank you so much, Dean Williams. And thank you so much, Director General Tedros. It's just a delight to be here. I'm actually a Takami Fellow at Harvard, which is such a pleasure. I wanted to thank you so much for, in such a brief period of time, illustrating for me what I think is this principle of public health as politics writ large. Almost all the points that you raised, where you talked about the importance of science, but then science is being undermined. Then you talked about the importance of equity in science. You talked about the importance of global health agreements. And finally, you got to this issue of trust. And so it really makes me think that this infodemic that we have, this pandemic of misinformation and malinformation, which the WHO has been taking up very much, is really one of our biggest challenges. And we definitely have been talking a lot about that at Harvard, how the infodemic is one of public health's biggest challenges right now. And so I just wanted to ask you, given the politicized nature of the infodemic and how this probably isn't going to be the last time we're going to have to address this, what other plans do you have besides training? I've actually been trained in infodemic management by the WHO. So what other plans do you have sort of looking at all the larger political threats to public health that are coming at us?
Yeah, thank you. I think to fight, be it infodemics or misinformation or disinformation, not only that, to fight pandemics, the most important thing is national capacity, what we do at national level. And that's why we are saying that the first thing we should do now is, building national capacity. That's where the right communication can be communicated with, society or with citizens. or the right actions can be taken by mobilizing the community, and also the right infrastructure can be built to fight pandemics, starting from prevention, early detection, and response. So whatever we do, I think, should be channeled towards building the national capacity and building the capacity in all aspects. So it can, starting from prevention to early detection response, should be done at country level. Then it's that national capacity that can bring the regional and global capacity as well. When I say regional, as Michelle said, I fully agree the job that John Kengasong done. This organization, Africa CDC, has evolved now as one of the strong institutions, and it's supporting, the whole continent. So there is a national capacity building. There is also a continental capacity building. Then you have the global. So we're trying to support from headquarters both continental and national capacity. By the way, not only we're working with Africa Medicines, Africa CDC, we're supporting and strengthening that both technically and financially. Normally, WHO doesn't give financial support, but for Africa CDC, since we believe in regional capacity, we're also providing financial capacity. And we're providing technical and financial support also to Africa Medicines Agency. So it's strengthening national capacity in all its aspects, all the things we have saying, whether it's primary healthcare, public health, R&D, and so on, and then regional capacity to support the national capacity, and orient ourselves, the headquarters, to support both regional and national capacity. So that's the orientation. So misinformation, disinformation is part of that, and it can only be addressed if we can develop a strong national regional capacity, and that's supported by the global movement that we have already started. Thank you.
Thank you, Farah. Dr. Tedros, we have one more question, and it comes from Adam Michael, who is a member of the Harvard Kennedy School community. Adam, over to you.
Hello. Thank you, Dr. Tedros, for everything you've been doing in the global playing field. It's a privilege to meet you, sir, and it means a lot extra to me being a fellow Habesha person. My question is in regards to Africa. Testing limitations and institutions aside, why does it seem like the whole continent of Africa, other than South Africa, have been relatively resistant from COVID-19? Compared to Brazil and India, also in the same tropic area, who happen to have pockets of underdeveloping conditions along with condensed populated zones, why hasn't COVID-19 severely impacted the continent as it has in other parts of the world?
Yeah, first of all, it's very difficult to say Africa has not been impacted. There is one very strong picture which I actually saw some months ago. This is a photo from Tanzania. The former President Magufuli, and his other three colleagues were actually in one picture, just one photo. I think they were doing some official ceremony. And the four of them were in one picture. All of them have passed away. And this is due to COVID. One thing I can share with you is there is underreporting. And we have done some mortality surveys, and we have found out that the reported number of deaths and actually the estimate now that we have from the surveys is different. So there is a higher death rate actually than reported in many countries. But this is not just specific to Africa. There are also other countries elsewhere from other continents actually who reported less than what could have been the reality. So that's one. But on the other hand, it's also true that Africa could have been affected less. And could be because of its young population. It's the demography could also be an advantage. And there could be, of course, other factors. I remember as soon as the COVID hit, we had a meeting in February 2020. I was invited to join. There was a continental meeting, and the ministers of health of Africa were developing continental strategy. So probably that could have also helped and started a joint and continental strategy that they agreed to implement in all countries of the continent. So I wouldn't undermine the impact, already serious impact, and the deaths could have been underreported, but the demography could have helped, and the early development of the strategy, the continental strategy, could have helped, and also the exercise in public health because of the repeated attack by infectious diseases which exists in low-income countries compared to high-income countries could have also helped. So there are many factors, and it has to be studied very well, by the way, and that we should draw a lesson from all those factors that could have given some advantages or disadvantages to Africa and other places.
Thank you. There's still so much to learn.
Thank you.
Thank you.
Thank you for your question, Adam. Dr. Tedros, let me try to thank you warmly in your language, Amharic. Amase Nagalo. Thank you so much.
Thank you.
Thank you so much for your leadership and for the inspiration that you've provided to all of us as you lead us through this pandemic. I also want to thank all of you who chose to participate this afternoon in this offering of the Institute of Politics. Let's carry forward the lessons learned and let's carry it forward to lift the health of nations. And I'd like to say again, thank you to all, and I wish you a good day. I'd like to also now turn over to you, Mark. Thank you for having me join you this afternoon.
Thank you, Dean Williams, for so thoughtfully moderating today's conversations and for your leadership. And Dr. Tedros, thanks you. I join with Dean Williams and Dean Elmendorf in the inspiration of your public service. I want to invite everyone to 4 forums next week. Building on Dean Elmendorf's comments at the beginning, we turn to the subject of Ukraine, when our colleague at the Kennedy School, the director of the Belfer Center, Ash Carter, of course, the former Secretary of Defense, at 6 p.m. will be in person in the forum for important conversation on the invasion in Ukraine. Later that evening, on Wednesday at 7:30, we will host a virtual forum with our colleagues at the Shorenstein Center on the constitutional case for saving the news, with university professor and former dean of the law school at Harvard, Martha Minow, will be in conversation with our own colleague, Nancy Gibbs, director of the Shorenstein Center. On Thursday, we turn to the topic of COVID and bring back a panel that was our very last in-person forum before the university closed in 2020. Dr. Julia Kayam, Dr. Mina from the Public Health School, and Rick Burke will be moderating. We bring them back. This is now their 3rd return on the important subject of COVID. And finally, on Friday at 4 p.m., we welcome Harvard alum back to the university, Congressman Jamie Raskin, to talk about the challenges of democracy, one of our themes at the Institute this year. All of this is on our website. All of you are most welcome to register for these important in-person and virtual, and of course, all of them are publicly available. So I end with my thanks to the McNamara family, to join with Dean Elmendorf in thanking Dr. Tedros, and of course, Dr. Williams. Thank you so much.